Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD in Ayurvedic medicine and MD in Ayurvedic physiology, that is Kaya Chikitsa and Kriya Shari. For paid online consultation, you can definitely WhatsApp me on 9226810630. As you know, we are making the series that is like a TV serial Ayurveda in GP, that is Ayurveda in general medical practice. And today we are going to discuss one of the important disease that is called as epileptic fits or the attacks. I think everybody knows like our heart is working rhythmically. Lup, dub, lup, dub. I am talking about heart. Similarly, in our brain also, there is electrical circuit and all the brain functioning is in a coordinated manner. Electrical signals are very coordinated. But whenever, like your heart beats, lup, 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 irregularity, arrhythmia is there. Similarly, in the brain, if there is arrhythmic electrical signals, then that particular disease is called as epilepsy. And the common finding is a convulsions for a few seconds. But yes, this happens, and this disease can prolong for a longer duration. There are the different causes. In Ayurveda, this particular condition is called as a apasmara. Remember this word, apasmara. And if it is a historical attacks, that is called in Ayurveda as a unmad. But apasmara can be compared with the epileptic fits. This is basically disease of the brain, and this is the problem of Vata dosha predominantly. Of course, this is a three doshatmaka, but predominant dosh is a Vata dosh. Why? Because Vata, Pitta, and Kapha, these are the three bioenergies in our body, and Vata dosha is responsible for all types of movements. It may be the heart sounds, it may be the lung sounds, it may be the electrical conduction, neuronal conduction. So, nervous system is under control of Vata dosha. So, when the Chala guna is in excess or Vishama guna of Vata dosha is in predominant, then this particular thing can happen. But Ayurveda says dosha should attack on particular dhatu. So here I will feel that Majja dhatu is predominantly concerned with epileptic fits. So on one side there is a Vata dosh, on the other side there is basically Majja dhatu, and also Majja vah srotas is in concern with the epileptic fits. So any type of the Vata treatment is very useful for epileptic fits. Simple thing, the patient should take a nourishing food because Dhatukshay-janya Vata Prakop is important. But here, both the things can happen. Dhatukshay-janya Vata Prakop or Margavarodh-janya Vata Prakop. There may be some obstructions like the tumor or any growth. That can be the problem for electrical signaling in the brain. So Vata dosha is disturbed. So to control the Vata dosha, the simple things are oil massage, number one. Number two is a Shirodhara. Number three, as this part is above the clavicle, so Nasya or the nasal drops, that is called as, yes, Nasya is a treatment for Urdhvajatruggata Vikareshu Visheshat Nasya Mishrate. Whichever the disease is above the clavicle bone, it may be ear, nose, throat, or ophthalmology or brain problems, then the Ayurvedic treatment, Nasya, is the best treatment. Then Shirodhara to cool and calm that rhythm, to maintain the rhythm, oil massage or oil application or oil lubrication is very important. If we want to give the proper snehan to the head, then we can apply the four types of Murdha Taila in Ayurveda. For example, Shirobhyanga, that is head massage, then Pichu, that is keeping the oil swab at the vertex of your part. Then there is a Shirobasti, taking the leather cap and putting the oil there, and the Shirodhara. So these are the four types of oleation to the head. That is called as a Murdhati. Then the best treatment for Vata dosha is, of course, the Basti treatment, that is medicated enimeta. It may be Anuvasana Basti, or it may be the Asthapana or Niroha Basti, or it may be nourishing Basti like Yapana Basti. I think this is the predominant thing. Then one thing I must tell you that whatever the treatment you are doing for epilepsy, it should be consistent treatment. Don't make a haphazard treatment. Starting, stopping. That is not good, number one. And whenever, if you are taking the Gardinol, if Eptoin, any modern drug, if you are taking, it should not be stopped by any doctor, by any patient, of any pathy. Any pathy doctor, because many times I have seen that Ayurvedic and homeopathic, by chance, I'm not blaming to all my colleagues. I respect all the doctors, but some doctors, basic understanding they lack, and then there is a problem. If you stop automatically any treatment of epilepsy, it will be rebound. Double things will come. So if you want to shift from, for example, from allopathy to Ayurveda, from Ayurveda to homeopathy, or Ayurveda to allopathy, don't stop any medicine abruptly. Step by step, then you can stop. You can start both the treatments simultaneously. Some allopathy drug also, and some Ayurvedic external, internal medicines also. So my dear friends, these basic things are very important. Next is, there are basically two types of epilepsy: grand mal epilepsy or petit mal epilepsy. Okay, so grand mal epilepsy is a little bit many more time, and petit mal is a fraction of seconds or a little time. Then in the epileptic, generalized fits are there in the grand mal epilepsy. That's why it is a grand. So first there will be aura, that is hallucination. Some will feel that I am hearing something. Some will say some visionary things are there in my front. And then immediately there is a tonic phase and clonic phase. Tonic is a stiffness and clonic is like shivering. So all these things are happening for a few minutes, and after the fits, the patient goes to the sleep. That may be few minutes or even for hours. So these are the sequence of that epileptic fits. So my dear friend, this is the introductory part. Now let us start to discuss about causes, investigations, and Ayurvedic treatment, Ayurvedic prescription by the experience and knowledge of Dr. Deshpande. Okay. First reason is idiopathic. There is no specific reason that can be found. Of course, there are a lot of investigations we can do for the epilepsy also to rule out the complicated problems. There may be some hereditary tendency in your family. There may be father, uncle, aunt. They may have this type of epileptic problem, and it can be carried forward in a generation. Then there may be some another disease, and these fits are only secondary. That is called a symptomatic type of the fits. Now, first we will talk about intracranial causes inside the brain. Increased intracranial pressure. It may be because there is tumor. It may be the benign or it may be the malignant cancer. Then hydrocephalus in the newborn baby, subarachnoid hemorrhage because of the hypertension, uncontrolled hypertension or shooting of hypertension can cause bleeding in your brain. So don't miss any single tablet of hypertension. Never stop the antihypertensive drug immediately. Keep some tablets additional as a stock, because if by chance there is some problem in the city, shops are closed, and automatically your medicines has been stopped, and you don't take the antihypertensive medicines for even 2-3 times, it can shoot up your blood pressure. So some my words are very strong, and you should remember it very carefully. Inflammatory conditions of the brain or meninges, that are the coverings on the brain, meningitis, encephalitis, neurosyphilis. Syphilis is a sexually transmitted disease, venereal disease. Cerebral cysticercosis, like a cyst of type of, but very rare. Trauma, intracranial, road accidents, for example, head injury, vascular cerebral atheroma, hemorrhage, thrombosis is a blood clot, embolism is a moving blood clot, hypertensive encephalopathy, stroke Adams syndrome. Now, congenital abnormalities like cerebral dysplasia, tuberous sclerosis, degenerations like cerebromacular degeneration, diffuse sclerosis, or lipidosis. Then extracranial causes, like not in the brain, outside in the body, toxins, exogenous. You may have the heavy alcohol drink, cocaine, lead, arsenic, cardiazol, nicotinamide, camphor, this type of poisoning. Endogenous, like eclampsia in the pregnant woman. Albumin is high, blood pressure is high, and that is called as eclampsia. Uremia, if his kidney is not functioning properly, urea in the blood rises too much, and that is uremia. Then hypoglycemia, if you are the diabetic patient and your blood sugar automatically, immediately, accidentally drops, that means you are not eaten properly and taking the insulin. So what happens? The blood sugar, in spite of 80 to 120 milligram percent, it drops down to 60, 50, 40 milligram percent, and patient become hypoglycemic coma. At that time also, this particular fits can occur. Then hypocalcemia, then anoxemia, asphyxia, less oxygen, carbon monoxide poisoning, metabolic disorders like alkalosis or phenylketonuria, endocrine causes like tetany, condition of the childhood like teething rickets, pyridoxine deficiency, etc. Now, what you can do investigation? First is like in the heart, we do the ECG, electrocardiogram. Here, EEG, electroencephalogram for establishing diagnosis of epilepsy and aid in determining the type of seizure, that is convulsions. CCF, here cerebrospinal fluid to rule out the meningeal causes. Then fasting and postprandial glucose blood sugar, or in emergency random blood sugar to rule out diabetes mellitus. Blood urea, if there is a kidney problem, to rule out the uremia. Serum calcium to rule out the hypocalcemia. VDRL, that is for the sexually transmitted diseases, to rule out the syphilis. X-ray skull for evidence of the intracranial tumor. Nowadays, we can do the MRI or CT scan also. Pneumoencephalopathy or cerebral angiography for detecting abnormalities in the brain. Now, treatment, rule out the cause and then treat accordingly. Patient may need hospitalization. In such cases, only for investigation and find out the focus of the disease. If now patient is unconscious, now whatever I am mentioning is only for the expert Ayurvedic Vaidya and treating in the hospital. This should not be practiced by any layman. This is contraindicated because these are the very serious things and we should not play with the patient. Okay. But by research, by specialized Ayurvedic Vaidya, this is done at some hospitals, not all the hospitals. Pradhamana Nasya is a powder stimulation to the brain. Vacha powder may be bringing back the consciousness, but only for the expert Vaidya, only for the Ayurvedic hospitals. In case if the patient is having fit, patient should be saved from all mechanical injury. If it falls down on the what you can say, the pointed any matter or the metallic like iron, then he may get the injury. So be protective. Then tongue bite should be prevented. Tongue bite can be avoided by specific training to the patient. In case if the patient is conscious, then what Ayurvedic management can be done. Okay, so Nidra Karavati from Hari Parshuram Aushadhalaya from Pune city, Maharashtra state, India. From Khadiwale Vaidya, this pharmacy is there, Hari Parshuram Aushadhalaya. Nidra Karavati, 3 tablets stat, then tablets Siladin from Allersin company, 3 tablets stat. This is either or, but you can add Mahayogaraj Gugulu, 2 tablets stat, because this controls the Vata activity. In case if the patient is out of the fit is not going on, then Kurasani Ova 250 milligram plus Sarpagandha 250 milligram 3 times in a day. Then Manasa Mitravati, Arya Vaidya Shala Kottakal, Arya Vaidya Shala Kottakal. They have the best medicine. Manasa Mitravati, Vati means tablet, 1 tablet 3 times in a day. Prashama is a liquid and also tablet from Ayurveda Rasashala company from Pune city, Maharashtra state, India. 3 teaspoons with equal amount of water every 3 hourly. Then another prescription for different patient, Sutta Shekhar Rasa, because it is said that it is a Pittavrita Vata. Okay, inflammation is there and also Vata is disturbed. 1 tablet 3 times in a day. Jatamansi for tranquilizer, 1 tablet 3 times in a day. Raupya Bhasma 30 milligram plus Samira Pannagaras 30 milligram plus Mauktika Bhasma 30 milligram 3 times in a day with Jatamansi Grita. Grita is the best for brain. Always remember, medicated ghee, 2 teaspoons. For prevention and Rasayana, another prescription, Avegavastha, when there is no attack. But we want that this patient is having minimum 3 attacks per month and attack remains for longer, then we can, Ayurveda can reduce and reduce the frequency and intensity of the attack. Okay. In Ayurveda, when the convulsions are there, that is called as a Vegavastha. And when there are no convulsions, patient is normal, that is avega avastha. Again, for epileptic fits, there is some advice that I can give you the last. Smruti Sagar Rasa, 250 milligram, 3 times in a day with Brahmi Prasha. Brahmi is a specific brain tonic. Vacha paste, half teaspoon. It's very hot, so be careful. If there is a bleeding disorders, if there is intracranial hemorrhage, don't use vacha or the calamus. Vacha or the calamus is very, very hot. It stimulates to the center, brain center. But if there is a pitta dominant prakriti, pitta dominant diseases, ulcers, bleeding, then vacha is contraindicated. Don't use vacha or the aqueous calamus by any way, by not for nasya, not for internal powder, etc. Okay, half teaspoon 2 to 3 times in a day. Old ghee, 2 drops in each nostril in the morning. Head massage, just now I have explained. Brahmi oil, Ayurveda Seva Sangh Nashik. Anuvasan of vacha tel every day and nasya by vacha oil. Next prescription, or in spite of vacha, you can use the Panchendriya Vardhana Tail. Indriya are the sense organ. Panchendriya Vardhana Tail is a nourishment for the internal sensory centers. Okay. Then Memotone Ayurveda Seva Sangha is a tablet, 2 tablets 3 times in a day. Raupya Bhasma Ayurveda Seva Sangha Nashik, 125 milligram tablet 2 times in a day. Another prescription, my dear friends. Then Sangeshwara Pishti, 250 milligram to 500 milligram 2 times in a day with honey, Anupana. Old ghee, maybe Brahmi Grita or Maha Kalyanak Grita, which is very specific for epilepsy. Panchagavya Grita, it's little bit not good for the taste or the smell. 4 teaspoon with warm milk. Then tablet NFD by Charak Company, 2 tablets 3 times in a day. Brain tablet, Baidyanath Company, 2 tablets 3 times in a day. Ask the patient to eat rice served on the pimple leaf, that is Ficus religiosa, every Sunday. Actually, this is a what you can say the experienced treatment by some Vaidyas, but research has to be made on this particular experiment. Rice served on pimple leaf, cooked rice, it has to be kept on the pimple leaf, Ficus religiosa. This is mentioned by Pune ex Vaidya. He is not no more. Vaidya Yago Joshi sir, and sometimes by Vaidya Khadiwari Vaidya, he is also no more. But these Vaidyas, they themselves have taken these experiences and then they have written in their books. I have just made a comparison. Personally, I am very sorry. I have not done anything with this rice served on the pimple leaf. Sorry for that matter, but I should be very honest and transparent. Okay. Special note: minimum 5-year treatment is necessary after the last episode of epilepsy. This is the most important statement in today's my lecture. Epileptic fits, when it is last fit is over, then you have to continue allopathy, Ayurveda or homeopathy treatment for next 5 days. Then there should not be any fit. Then I can say that it has little bit cured. But otherwise, don't stop medicines haphazardly. Okay. Regimen, what the good things for the controlling the epileptic fits: old rice, wheat, gehu, that is mung beans. Mung bean is the best anti-pittakara. Ghee is the best medicine for these brain problems. Milk, barley, pomegranate, grapes, amala, coconut water, vacha, and massage. But stress, restlessness, heavy meal, and heavy food is very, very bad for epilepsy. So, my dear friends, in today's lecture, we have talked much about the epilepsy or apasmara in Ayurveda, which is a disease of Majjavaha Srotasa, Majja Dhatu, and the Vata dosha is basically irregular. So this patient have a routine lifestyle because Vata dosha is prakupit with the haphazard activities. Then he should avoid the Vata prakupit ahar and vihar. No hectic schedule should be there. And most important, last but not least, this patient should not be allowed to drive the vehicle, number one, unless and until there is assistance. Okay, better way, he should not drive anytime, because anytime he gets the fits and there may be road accidents. Number, driving should be allowed, not allowed. Then what next? Working near the furnace, not allowed. Working on the high areas where there is a fear of fall, don't work on the higher areas. Don't work near the water. Swimming should not be allowed. Why? because accidental problems may arise, because epileptic fit can occur at any time of the day and you cannot predict that thing. So to prevent the life of the patient, I am suggesting the driving, swimming, working near furnace, working near the fire, these all the things should be avoided by this patient. My dear friends, to get such interesting and knowledgeable videos, please subscribe my YouTube channel and don't forget to press the bell button icon to get the intimation of newly uploaded videos. I wish you all the best and take care, and see you soon in my next video. Till then, thanks a lot.